Hey, what's going on? This is another pre-Chiro podcast. My name is Dr. Ben Glass. I'm a chiropractor, and today I have the pleasure of connecting with a chiropractic student, Alecia, who's out at Palmer West in San Jose, California. Alecia, thanks so much for taking some time to share your insights with any prospective students considering this path. Can we just get started by you sharing a little bit about what your background was before you went to chiropractic school and what attracted you to become a chiropractor?
Absolutely. Thank you for having me, Dr. Glass. I really appreciate you taking the time to pay it forward, but also having a platform like this. Like we kind of discussed before, you not having those opportunities to, other than, Dr. Google giving you an insight, it's nice to be able to actually speak to docs and students and just have that insider information. So for myself, I am from Toronto. I'm from the Canada area, for those who don't really know where that is. And I have, interacted with a variety of different doctors in my life. So I've been an athlete since I was 3, but kind of leading into my more adult life, I went to the University of Illinois on a track scholarship. And then when I graduated, I kind of harnessed my athletic abilities and I was on the Canadian bobsled team. And in my 2018 Olympic season, we actually had 3 docs that were on the circuit with us. One went to CMCC, which is the only chiropractic college in Canada. And then one went to Western States. And then we had one that went to Palmer West in San Jose. And for me at the time, after that season, Olympics was always the goal and had just nearly, missed competing at those games. And I still kind of keep it in the back of my mind whether or not I want to go back. But I knew I wanted to be a doctor. I knew I wanted to be in more manual and physical medicine, not just kind of sit back, write a script and say, go to someone else. I wanted to be a part of the process because for my journey, there's always been someone by my side, a part of my process, and I wanted to be able to pay that forward. So having 3 docs directly with me, being able to kind of pick their brain a little bit about what their philosophy was like, what their school interaction was like, talk about the cost and benefits and all those kind of things. I connected really highly with the doc that went to Palmer West. And I didn't really know of that option at the time. I knew of, the Canadian Memorial Chiropractic College. And when I was looking into kind of the application process, I also didn't want to wait a full year to apply. So that was another draw for me that I could get started on kind of the next part of my journey sooner rather than another, 365 days before I'm applying and then before I'm actually getting in. So with that
Mm-hmm.
kind of being said, I looked into some of the American schools. I looked into Palmer West, and the Sunshine obviously was a lovely draw, but
Mm-hmm.
the fact that it was evidence-based, the fact that it was a school that doesn't force you to go down one path. They provide you a variety of tools and they give you that option and opportunity to see what type of doc you want to be when you graduate, was a huge draw for me. And that's what brought me to Palmer West.
Okay, so you mentioned a couple of things I'd like you to expand upon there. You were an Olympic athlete and also a college athlete. So your work ethic, your discipline, your dedication to training was obviously top level, and you had support. Can you talk about how that's translated to you as a chiropractic student and how important it is to be sort of resilient when things get difficult? You keep going. When you don't want to show up, you show up. And just what's it been like? Where are you at in the program right now? And how's that journey been for you as a chiropractic student?
So that really hits the nail on the head. Resilience is key. For myself, I am currently in ninth quarter, or I just finished ninth quarter, so I'm going into 10th quarter, which means I'll be in outpatient clinic. Uh, it has been the ups and downs of, I don't know, the hardest and most challenging thing that I've ever experienced in my life. For myself, because I also was pursuing my athletics for a period of time after my undergrad, I was out of school for almost 10 years. So figuring out how to study, what is Quizlet, what is, all these different resources that students have been using was definitely a learning curve, but it is a part of the journey, and it's been great having that athletic background, being able to say that, as a student athlete, I was a student first and an athlete second, and taking those same principles of, if you don't show up for practice that day, you're not going to get better. It's the same thing with my technique. If I'm not practicing, if I'm not going and palpating as many people as possible to figure out what I'm hallucinating under my fingers, it's just not going to get better. So I've definitely taken all of kind of the core things that make me and made me a great athlete to get to those different stages of my life, and I've applied that to my education, and it's definitely been it's been tough as we've kind of transitioned to that online training, and for, I would say, the seventh, eighth, and ninth quarter, where we were a hybrid program of being online and being in person. And we'd have to, basically practice with inanimate objects because we just didn't have those, direct hands-on training, using resistant bands and kettlebells and pillows and stuffed animals and things like that. So similar way that, when you're training and you don't necessarily have all the equipment that you need directly in front of you, use those kind of I guess, innovative ideas to continue my training and
Mhm.
potentially becoming the best doctor that I've experienced in my life, and then be able to pay that forward and be that same doc moving forward.
Yeah, I mean, being in a ninth quarter position, you're about to enter into outpatient clinic or whoever. However, can you describe like what you're about to go into in regards to Palmer West's clinical experience and how you understand it, or how you've been involved in it up until this point in ninth quarter, and then also touch on some of the most influential things that you've gained experience with and that you've been exposed to that have shaped you into the type of chiropractor that you're becoming?
Absolutely. So in ninth quarter, we're in student clinic. So we are treating our classmates as well as upper and lower quarters. And then as we go into outpatient clinic, we are initially just going to be shadowing with our mentor clinicians. So typically, you'll be assigned one clinician that all of your patients will be seen under. And uh, for the first few months, you are usually going to be a secondary. So it's just going to be a lot of absorbing and learning as we watch. And then if you have patients that that are, or individuals that are in the community that want to come in and be your patient, you can definitely do that as well. So I'm looking forward to kind of diving in and getting that actual experience, but knowing that the individuals that are in town know that we're also learning. It's a learning facility, that they give us that opportunity to have that first contact with not just a student that understands when you say please lie supine, and they know what that means. You have to be able to transition and have that wit to say, okay, I have to use lay terms in certain points. So far, I would say the most influential thing that has kind of occurred is having some new staff that are individuals of color. That's been extremely encouraging to see a bit more diversity coming directly in my viewpoint, instead of seeing it
Mhm.
from afar and hoping that I can have that interaction with individuals as well.
Mhm.
And that representation, I guess you don't really think how much it matters, but it matters so much to be able to see someone that looks like you, that's successful in doing the things that you aspire to do. So
Mhm.
having my school kind of evolve with the times and realize that they need to seek out as much representation as possible has been really encouraging as well.
Yeah, no, that's really great. I did a little bit of exploring on your Instagram, and I just want to touch on a couple of things that I saw you doing back in 2015. Now, probably before you went to chiropractic school, that I think can help chiropractic students or pre-chiropractic students prepare for chiropractic school. And I'd love for you to kind of just touch on what that experience was like. So, one thing you did is you did a fundraiser to raise money for yourself to go and train wherever that was for the Canadian bobsled team. And I think that that's super crucial. You talk right now about you're about to go into clinical experience and you're going to go out into the community and reach out to people and really represent yourself. And I think that's exactly what you gained experience on before you went to chiropractic school. And can you maybe just draw from previous experiences that you had where you had to put yourself out there, you had to maybe get a little uncomfortable, and you had to just have a little bit of faith that if you just showed up and you were yourself, you were authentic self, um, asking of others to support you, how that might help you in regards to your confidence or in regards to just maybe some of the skills you picked up along the way in regards to entering the student clinic today?
Yeah, one thing that that process really taught me is that at all times we are a brand. We are a representation of what it is that we are speaking on, that you're living kind of that truth. And when I was asking, individuals to support me, it wasn't so much that I, wasn't going to work towards, um, finding a normal job or anything like that. That's something I was also doing. But having that support from the community and allowing them to go on the journey with me was extremely important for me because it allows me to be a part of something that's bigger than myself. And I think that's something that happens in this profession and along this journey because it's patient centered. You could
Mhm.
have 17 chiropractic clinics on the exact same street, and at the core of it, we're all offering the same thing. We want to get you moving better, not having any dysfunction, pain free, and just living your best optimal life. But they'll come to see you or they'll come to see me specifically based on personality, connection, and like you said, being an authentic self. So the individuals that I've had the pleasure of, working with me, getting me back on the track, whether it was hot or cold track for that matter,
Mhm.
was that kindness and that care and being able to be a therapist, a hairdresser, all the different hats that you have to wear when you're so intimately involved with someone that is trusting you.
Mhm.
That part of asking for help is a part of that vulnerability. And I think that every student that is looking to get into a patient centered career needs to realize that they need to put a little piece of themselves out there so that you can connect with individuals on that personal level. And that's why they really come and see you, not just because you're going to provide an adjustment and provide some soft tissue mobilization or anything like that. It's because they really connect with you as a person and they want you to be a part of their journey as well. So that's
Mhm.
kind of how I connect the two for sure.
Mhm. And being an Olympic athlete, I'm sure that you worked with physical therapists, you worked with athletic trainers. I know you said you wanted to be a doctor, but what was it that really stood out to you that you wanted to become a chiropractor, or when was it? And what was that sort of differentiating factor, or what was the biggest shift that you had inside of you that helped clarify that for you?
So, two big things for me was wanting to be a part of the process instead of just diagnosing and saying, this is what I think you have. Now go off and see all these other individuals. I think a multidisciplinary approach to any problem is definitely key, but I want to be a part of that process instead of just saying, this is what I think it is, go off and hopefully come back and see me in a few months. There's a bit more patient interaction, connection, and interpersonal relationships that I think is so great about the profession. And the other thing is the autonomy. Being able to open up your own practice right after that or after a few years, being able to set your schedule, how you'd like your
Mhm.
lifestyle to look instead of, um, oh, I'd like, a week off. And then it's like you have to go through this chain of command of, well, would the hospital let you out and things
Mhm.
like that. Just having that option was a huge draw for me. And I think part of that was being an athlete and kind of working towards so many different things at any given time and being able to just on a whim, okay, I'm going here, I'm going there. I think that this profession in general has that dynamic in it is, and that's kind of all I know. So that
Uh-huh.
was definitely a huge draw as well.
No doubt. And what can you talk a little bit about what it would look like to have more diversity in the chiropractic profession, to have more people that represent the types of backgrounds that are the majority of the demographic nowadays, probably both in Canada and America, definitely in the US right now. People of color, whether black, brown, Puerto Rican, or Asian, Indian, make up a whole different wide scope that I don't think is being targeted as much by the profession as it could be. Can you talk a little bit about maybe some of your intentions after you graduate to represent, and also what it would look like as a profession for us to be able to represent the demographics a little bit better?
Absolutely. So for myself, I didn't really see very many black doctors, black female doctors, whether or not it was a chiropractor or an allopath. And as I got older, I started to realize like it would be important for me to just see someone that looked like me and have those conversations. And as I was looking into schools, I actually did meet a few docs, and I was like, it's so great, but I want to know like what are some of the trials and tribulations that you went through getting to this point? Did you find that there was more pushback? Did individuals not trust you as much? Like, what are some of the things that I should know as I'm going into it so that I can kind of prepare accordingly, but also just provide potentially that same shining light that they provided for me to someone else moving forward. And when I got to Palmer West, I connected with the Student American Black Chiropractic Association, something that I didn't even know existed. And now I'm the president. And talking to a lot of docs, it's so interesting that the chiropractic profession was built off the back of a black man, and the black population still doesn't, from a greater, majority, doesn't even know that this is a viable option for care the way that they should. And so for me, I want to preach that it's not just an alternative to care. This could be your primary, like a chiropractor is a primary care practitioner, and this could be the first place that you're going for all your musculoskeletal issues. And it's not just, oh, that could be something that I do if I was in a car accident or if I had pain. It could be the same way that you're thinking of, this is the system that controls your whole body. You want to take care of it because you only have one body. And I want to be able to let individuals know that you don't have to be in pain before you're going to see somebody. You want to keep that maintenance up in general so that you're feeling your best instead of feeling your worst so that you can feel your best.
Mhm.
And there's a level of trust that individuals have when they see someone that looks like them. And when they hear a story that is similar to their story, and just having that intuitive connection that you walk into a room, and if you are from, let's say, Illinois, and you see that giant eye on someone's chest, or you're a New Yorker and you see a Yankees hat, you're drawn to go to that person that just automatically has a similarity to you. So I'm hoping
Mhm.
that that is the same kind of um, attention or intention that will happen when someone sees my name on a poster or something like that, like, ooh, a chiropractor, she looks like me, maybe she'll understand my plight.
No doubt. Yes, no, I agree 100%. I think it's super important that the messaging is right, and just the vibe, the whole way you carry yourself. You're going to be able to reach people that might not trust somebody. I don't want to say that looks like me, but that might look like a little bit older or stale, or just out of touch with the background experiences that certain populations are dealing with or have dealt with, and continue to deal with, but need to be acknowledged if we're going to really help them heal. Because a lot of, as you say, neuromusculoskeletal, or as you say, just body talk, a lot of that stems from mental, emotional experiences or trauma. So yeah, I think that is crucial. And as a chiropractor, you have the ability to touch your community in a way that no other healthcare provider does. You can really be out in your community, whether that's just right outside the Parks and Recreation office, because you know that's where people come to be active, or that could be at your gym, or that could be anywhere. You know, you're on site as a chiropractor. You bring your hands, your mind, your heart with you everywhere you go. So you really do have an opportunity to practice anywhere in the world. Have you thought about where you might want to travel to after school? What your transition might look like? Do you have any plans yet, or is that still really coming together? And if so, what are some of the questions you're asking of yourself right now?
So right now, those thoughts are consistently percolating in my head, especially as I start to study for boards. So I've done my American Part A's. The plan is to do both my American and my Canadian boards, and looking into my preceptorship options. So in my 13th quarter, I have the opportunity to go out to a preceptorship where if you select the correct preceptorship, you'll actually get to practice under them for those 3 months, and then it can transition into employment. So I'm looking into those options right now. I'd like to stay in the States at least for a few years. Um, I haven't necessarily like pinpointed I want to be in this state or that state, because I think if I close myself off to potential options, then I'll just never, you know, eh, actually achieve that potential, but I could be closing off some really great opportunities. So right now, looking at locations in Texas and looking at some locations in California, and as well as still uh, connecting with the individuals that I have seen personally in the Toronto area as well.
Hmm.
I haven't set my mind on a specific specialty, because I also think that a lot of the individuals that I've spoken to, they say the first 5 years you're finding out who you truly are. You have this backbone of education, 3 years and a third to 4 years, depending on your program. And then you put it all together within those 5 years, and you're constantly evolving into who you want to be. So my mind, my eyes, my ears are all open to opportunity and options. I am also trying to be at this stage, because I'm going to outpatient clinic, a jack of all trades but a master at none, and then I can hone in on the things that I'm truly good at, and making sure that I'm treating my patient and not just providing them, the adjustment or the care that I'm good at. It's what they need. So right now, that's my main focus, being able to just have as many tools in my toolbox as
Hmm.
possible, so that depending on what doors I enter into or who comes into my doors, I'm able to provide the best care.
And would you say that's consistent in the student culture at Palmer West? Would you say that there's a lot of different tools or modalities that students are training in because they want to be able to help people in multiple ways? Or how would you describe how a typical student will experience that program from your point of view?
Yeah, absolutely. I think the first year is all our basic sciences. The program is really geared towards how you're going to be successful in passing your boards. That was another draw to Palmer West, that they had very high boards success rates for all parts of boards. And in your first year, you're not although the professors kind of consistently give you that statement of, you need to know this for boards, you need to know this for boards, you need to know this for boards. You don't really have that viewpoint of what that looks like until you're actually studying for boards. So that first year is all our basic sciences. The second year is our advanced sciences, as well as now we're getting into technique, we're getting into setups, we're getting into actual manipulation and care and adjustments. But that is kind of your second part of boards, as well as your third part. So the program really structures itself for success on your boards, but it also structures it in a way that you'll have success when you get to clinic, that you're able to look at someone as a whole, figure out, am I going to refer this person out? Am I going to co-manage? Am I going to use some PT modalities? Is this person going to be more passive care? Is this going to be active care? And it
Mhm.
constantly builds on itself. And then
Mhm.
when you're able to pick your mentor clinician, you get to read, their profiles on them, but you can also shadow them and figure out who is in alignment with what you want to focus on. So, like I'd said, I was able to pick my mentor clinician. He's an individual of color. He also has a business background, and that's something that for me, I have potentially learned that because of my life experiences with my athletics, that you can be as great with your hands as you want to be, but if no one knows that you exist and you don't understand the business component, no one comes into your door, and then you're not able to provide that care. So I
Mhm.
wanted to have that in my back pocket, that I'm learning from someone that has run a business themselves. They have worked for other people, and I think it's very important to learn from others' mistakes and successes,
Mhm.
as well as he is a very huge proponent of rehab as well as prehabilitation. So making sure that he has these protocols in place. And that was something that's also important to me, that there's a system. I won't
Mhm.
be able to tell if someone's improving if I don't know where they started from and if I don't know what progressions I'm bringing them through. There's other
Mhm.
mentor clinicians that their focus might be more on straight chiropractic care, where they're not using as many modalities, they're not using as much adjunct therapy. And it's great that those options are there, because for some patients, that's going to be the best course of action. So those different areas of interest are all available.
Mhm.
But I definitely think it's what you put into it is what you're going to get out of it. So for some individuals that aren't really asking any questions, they just don't get any answers because they just expect it to fall into their lap. And I think that's another thing that kind of came from my athletic background, that I was always questioning certain things, not necessarily to be combative, but to question it to understand the why. And
Mhm.
I definitely think that the clinicians that are um, at Palmer provide the why if you ask.
Dope. Dope. All right. Last question here. Or not last question, but just I'm kind of wanting to kind of bring it to a head. What are some things that that you recommend prospective students should do to maybe prepare to be more successful or have a more fluid adaptation to chiropractic school before they get to school? I know you said you took 10 years off, and so that's maybe a specific thing to key in on if you haven't been in school in a while. Maybe some specific recommendations there. But what are some other things that you think would be beneficial for a pre-Chiro student to explore or study?
Yeah, it it would be great to say that um, everyone coming straight out of high school into undergrad knows exactly what they want to do directly out of school, but it'd be unrealistic to say. So one thing that I thought was amazing to see is there was individuals that had art backgrounds that had a life altering moment that transitioned their life, and they really wanted to then become a chiropractor. So one piece of advice that I would give to any student that is just searching and not really sure is, even if you don't have a science background, it's not too late to still gain that knowledge, whether it's you're taking an additional course, whether it's you're taking some free online courses that are now offered. The pandemic really brought to head that there's a lot of free information out there and a lot of individuals that want to share their knowledge. But whatever learning style you have, you can harness that and apply it to the program no matter what. Will there
Mm-hmm.
be a little bit of a learning curve, and will it be a little difficult if you've never seen a cadaver or never taken anatomy? Absolutely. So I definitely think it would be best if you are taking an anatomy course. I think another great course that individuals could take is a medical terminology course, being
Mm-hmm.
able to know that itis is not just because you've eaten food and you're a little bit tired, it means inflammation, right? So having those kind of little skills that help you along the way. Not saying someone needs to learn Latin completely, but even if they, took a little intro to Latin to understand that a lot of these words that seem so far-fetched, they're named exactly as they should be named
Mm-hmm.
because of the body part, because of the location. So having maybe medical terminology, having some exposure to anatomy would definitely be great. But if you don't have a science background, just take your learning style, whether or not you are hands-on, whether or not it's auditory, if it's visual, you take your learning style, you put it into the program in general, and shadow doctors. One thing that I'm learning so often is while you are a student, everyone wants to help you, so take the help. If it's being on a phone call, being, that you're going into a clinic and you're just getting an initial assessment to see what type of doctor this person is and what type of questions they ask, what should I be looking for. Shadow a lot of individuals to find out not just what you do want, but also the things that you don't want. So I'm in
Mm-hmm.
that point right now where I just plan shadow and talk to as many docs as possible to find out the things that are of interest to me. Do I want insurance? Do I want cash practice? I didn't even know the terms until I got into the program, but if you
Mm-hmm.
if you're able to just talk to different docs, they will provide you so much information on the things that they learned along the way. And I would also say that if you are in the program initially, to get the board studying books right off the bat,
Mm-hmm.
because those moments when teachers are like, you need to know some boards, you just highlight it, put a star, put an asterisk beside that information, and then it guides you when you get to study, that it's not, looking at all the fine minute things that might be important. Like, oh, they talked about this and this, and I know those things because of the multiple exposure.
Mm-hmm. And then what kinds of apps or tools are you using to improve your learning experience? You said in the beginning of the interview there's a lot of things you didn't even know were available to students. I'm sure incoming students are going to already have some awareness about this, but are there any like key tools that you recommend students maybe get before they even go to chiropractic school just to familiarize themselves with how learning takes place
For
at that
sure.
level?
I I spoke to my roommate before coming in. She was a year ahead of me in the program, and I asked her that exact question, and she highly recommended that I had an iPad with a pen, because you do a lot of writing, and sometimes just directly on the notes, you need to jot down that one thing that's on the side. So for me, that was really, really helpful because I was able to interact with my notes and just be very, very present with them. And it could be with me at all times. My iPad goes with me everywhere.
Mm-hmm.
Um, and also having a laptop, because as you get into the later stages of the program and you're writing reports or you're writing lab read-offs and you're looking at x-rays and you want to be able to zoom in and things like that, sometimes it's nice to have two screens. Sometimes it's nice to have your textbook open. I personally downloaded majority of the PDF versions of the textbook instead of having a physical book. There's certain textbooks that I would keep uh, in an actual hard copy, but for the most part, everything is on my laptop and on my tablet. Quizlet has definitely been a great help, because if I am, walking to school, if I am, on a flight somewhere, I can just pull out, Quizlet and just kind of quiz myself, reading information, kind of consistently getting that multiple exposure. And it is kind of like a game. Some people are playing like, I don't know any of the gaming systems, but like I'm
Right.
sitting there playing a word game, or I'm on Quizlet,
Yeah.
and just having that kind of consistent access. So definitely say investing in a good computer and a good iPad that is going to allow you that opportunity to zoom in and really focus on certain things, and kind of envision, having 17 books in front of you, and you can have 17 different tabs kind of rolling through on the top of your computer. I'd say 17 tabs
Mhm.
is probably a little bit better.
That's what's up. Yeah, no, it's complex. There's a lot of layers. Sounds like 17 tabs is necessary at certain times. Well, listen, I want to thank you so much, Alecia, for sharing with the prospective students. If you want to reach out to her, we'll be sure to post a link so that you can connect or find her on Instagram or Facebook. And yeah, this is just providing more and more insight. We haven't interviewed anybody from Palmer West before, so I appreciate you representing. And it's cool to hear that you're part of the ABCA, because we have had a number of representatives on here, not only in the professional level, but also in the student level. And we'll just keep continuing to build infrastructure for prospective students so they feel supported every step along the way, and there's not too many surprises. There's always going to be surprises. Those are good, but the more we can eliminate those like unwanted surprises and those things that leave kind of a bad taste in your mouth, I think the better for anyone going into chiropractic school. If you want to explore more conversations like this, be sure to look through our channel Pre-Chiro on YouTube or Facebook. And yeah, have a beautiful day, Alecia. Happy New Year and all that good stuff. Keep it moving, keep pushing. Let me know. I'm in Oakland. I'm not too far. If you need to shadow or if you need to get exposure, we're still open, taking care of more people than we ever have through this weird and
Absolutely. I
interesting
welcome
time.
that opportunity. That's amazing. Yes,
Yeah,
thank you.
called the shift chiropractic. Well, yeah, any final comments or things? I don't want to leave it off without letting you just finish or wrap up.
Well, I just want to thank you, Dr. Glass. Honestly, this is such a great platform, such a great idea that has come to fruition. And I'm sure it's been something that you've been thinking about. This is kind of your baby that's growing. And I'd love to, connect you with more individuals from Palmer West so that we can just get the message out there about all the different programs, all the different opportunities that are available. And I just thank you very much for, giving us a place to share, and for individuals that just don't know, the more you know, the more you know. So it's awesome to be able to be a part of that. So I just want to thank you for that.
Yeah, it's my pleasure. Like I said to you in the right before we got on this interview, this is just something that I wish existed before I was here, and I appreciate the acknowledgement. And if you want to interview any other students, I definitely am opening that line so that students can be talking to students about what students talk about today. I was in school like 7 years ago, so. But yeah, when I first got into school, I was so surprised by how many different things there were that I had never heard of, that I just felt deep down inside. If I could expose that kinesiology student or that incoming chiropractic student to all this stuff, they could get a lot more out of their early education in school, and they can get that value. It's a very expensive investment. Obviously, it's an investment in self, but the more you know going in, the more you can leverage your time effectively. So that's really where this is coming from. And yes, you're right. 10 years in the making, and here we are.
That's awesome.
I'm passionate about it. I see how these little seeds that we're planting can really catalyze a big change in the communities that I care about most, that are kind of being forgotten about by a lot of chiropractors. So um, got to keep it available, keep it accessible, and the more people we have that come from places that have never been basically ventured out of into a chiropractic school before, I think the better off this profession will be. So anyway, I appreciate you. Have a great morning. Keep it
You as
moving.
well. All
All right,
right.
thank you.